John West is the director of surgery at BreastLink of Orange, a general surgeon by training. Dr. West became fascinated with the team approach to breast cancer care in the mid-1980s and opened Orange County's first breast care cancer in 1988, has been working in the field for over 25 years, and has written a book called Prevent, Survive, and Thrive, Every Woman's Guide to Optimal Breast Care. Why the book?
Well, women are confused. I mean, there's so many confused. When do you start mammograms? Do self-exam work? Is it okay to put a cell phone in my bra? The list goes on and on. With Angelina Jolie and the genetics issue, it's exploded. There's so much new information. But doctors don't have the time to discuss all this. So they don't have time to say, your breasts are dense, you need extra imaging, or you're at high risk, you need genetic analysis, or when to start mammograms, when to stop mammograms. So basically, I cut through all the crap and just say, this is what I'd recommend if you were my wife or daughter. And it's based on my 40 years experience. It makes it simple. There's great stories, but it makes a point. This book can be life-saving, and it can give women confidence that they're going to be receiving optimal care if they follow these relatively simple guidelines.
Now, you told me about a woman, that you got an email from a woman in Ireland that you didn't even know?
Yes.
Tell us that story.
It was a surprising email. I'm thumbing through it, and here's an email that says, "Thank you, Dr. West, for saving my life." And I looked, and it came from Ireland, and the name, I had no idea who this patient was. So as it turns out, the story was kind of interesting, and it's a common story. She noticed a little eczema-like changes, some skin changes, some flaking skin on the tip of her nipple. And she's a young mother. She was worried about it. She went to her doctor, and he says, "Oh, don't worry, just put a salve on it. It's contact dermatitis or eczema or whatever." She puts a salve on it. It's getting worse. She goes back at two months and says, "Doc, it's getting worse." He says, "Oh, I'll give you something stronger. Don't worry about it."
Yeesh.
Well, she did worry about it. She went on a Google search, and she found my name. I write an article on breast health every month through the Be Aware Foundation, and we also promote breast self-exams, so we send a reminder every month. And she found that article. She printed it out, and the article basically says if you have these kind of flaking changes on your nipple, you need a skin punch biopsy. So she copies it and hands it to him.
Oh,
he
my
reads
God.
it, and he goes, Okay, I'll send you to the surgeon. We'll get a biopsy. Comes back, she had cancer of the breast. It's Paget's disease. It's an unusual form, but when caught early, it's completely curable. Well, I have a chapter on Paget's disease, and any woman that hears this story or reads that chapter, that's the way I teach, is examples like this. And these examples stick with you. The word Paget's, you probably forget it in a day. But the story of the lady in Ireland who saved her life by a simple article, those kinds of stories resonate, and you remember them.
Well, and you said that it was 2 months before she went back to the doctor again, and breast cancer is all about catching it early, right?
Well, this is one cancer that tends to grow slowly, but in my experience, and I've seen dozens of cases, there almost always a delay of diagnosis. We had one patient that was delayed 3 years.
No.
It kept getting worse and worse. She went to 2 dermatologists and said, "I think I have Paget's disease," and they still didn't biopsy. She finally came to me. We biopsied it. The next day we had the result. It was Paget's, but this lady wasn't so fortunate. She had positive lymph nodes and had to undergo chemotherapy. The point is, if you recognize it early and you do a punch biopsy, you make the diagnosis, you can save the breast. You just take out the nipple and you use sometimes radiation, and that's all there is to it. So it's empowerment. Women need to know what to do when breast changes are found, and if they do know what to do and explain it to the doctor and take charge of their health, they're going to have a much better chance of catching it early and better survival.
How important is self-exam?
I think it's very important. Now, if you look at Komen Foundation, you look at the American Cancer Society, they say it doesn't work. Well, I'll agree with them 100%. If you don't do it properly, it doesn't really work, because most women check their breast before the onset of their period if they're menstruating. They feel lumps everywhere. It makes them nervous. Say, "I'm not going to do this again."
Yeah.
But here's the way it works. And I had a patient teach me this. I had a patient who was very good at doing the self-exam. She came back to me 4 or 5 months after exam and says, I feel a little change in my breast. I want you to check it out. I said, "What do you mean by a change?" And she said, "Well, it's not exactly a lump, but it just seems different." So I examined her. I said, "Well, you got really lumpy breasts. I feel what you're saying, but everything feels like this." Put the ultrasound on it, and there's a little cancer the size of the tip of my finger.
Oh my gosh! And because she could feel the difference.
She could. Here's the point. I now know that there was a cancer there. I went back to examine it. I've felt thousands of cancers over the last 40 years. I could not discriminate. To me, it was just more of a... So the woman who knows the pattern of her normal breast, does it regularly. If she's menstruating, she does it 5 to 10 days after the onset of the period. But if they watch my video on the Be Aware Foundation, do the exam after a doctor has said everything's normal, or a nurse, then the issue isn't to look for lumps. The issue is to learn the pattern of the normal, have it clearly in your mind, do it regularly, and trust yourself. If something changes, you will pick up a change. Then you go to the doctor, but you must be empowered, because the doctor might say, oh, it's nothing, don't worry about it, your mammogram's normal, you're too young, it doesn't run in your family, all these myths. But you say, no, doc, I read Dr. West's book. I want a directed ultrasound. I want a mammogram with cone compression views. If there's an abnormality, I want a vacuum-assisted biopsy. If everything's normal, I want you to follow me at 2, 4, and 6 months. Oh, and by the way, if you don't want to follow Dr. West's guidelines, I'll find another doctor. That's empowerment.
Good for you.
Thank you.
Now, what about all the controversy lately over mammograms?
There is so much controversy. It's just driving me nuts. We have crystal clear evidence that mammograms starting yearly at age 40 reduce breast cancer mortality by 40%. This is the newest study. But even better, now we know that the mammograms do miss some cancers, particularly in high-risk women and women with dense breasts. When we add screening ultrasound for average-risk women and MRIs for high-risk women, we're going to pick up most of those cancers that were missed. Therefore, we have the potential to drop breast cancer mortality in young women by well over 50%. And maybe up to 75%. So it's truly life-saving. Now, there's a group of intellectuals. I don't know who these people are. They're research people. They're basically saying that we're diagnosing too many cancers that would disappear without treatment. They're saying that you don't need to start till you're 50, do it every other year, and stop at 74. All this is based on totally flawed data.
Really?
Really. Really. And women will die needlessly. And this is coming through the government. The government, this committee is prepared to tell insurance companies that it's Class C evidence that mammograms really don't help in the 40s, and therefore you're not required to pay. That's
well, how are you going to fight this? What are we going to do about this?
Well, one of two things. Either they get on our campaign, go to change.org and sign our 40 not 50 petition and give us 1 million signatures so we can go to Congress and fight for women's rights and tell them the truth and tell them how flawed these recommendations are. Or you know what? We lost the battle.
People are going to die.
And people are going to die. You just have to let it. And they're not going to, you think it's about cost containment. These cancers are not going to disappear in the women in their 40s. They're just going to diagnose late. So rather than stage 0 or stage 1 where it's highly curable, they're going to be stage 3 or stage 4. The cost of treatment goes up, more surgery, more radiation, more chemotherapy, and many of these women don't make it. Their chances of survival are markedly reduced. It's ridiculous. It's criminal what the government is saying. We have to fight back. And this is the only ammunition we have. So signing that petition is critical. We need 1 million signatures. We already have 1,000.
Good for you. Is it a myth that younger women don't need to be checked as often?
Younger women are less likely to get breast cancer, but when they get it, it tends to be bad, more aggressive, and they tend to not respond.
Why is that?
I don't think anybody really understands that. I don't know if I can give you a clear answer. But we do know that that's a trend. And so women, and the only option they have to catch it early is self-exam. So I believe you should start examining your breasts when you get them, but certainly by age 21, and do it monthly and do it regularly. And then we've got to report a change. And then you've got to find a doctor that'll listen to you and evaluate the change. But I think we can catch a lot of these cancers a lot earlier. The other two groups are pregnant women and women are lactating. They're really tough, and we almost always find delays in those. And we've learned by using ultrasound and very careful evaluation with physical exam and appropriate imaging that we can detect a lot of these cancers when they're really small. But oftentimes these women come in to see their OB or their primary doctor and say, oh, it's just a milk cyst, don't worry. Or, oh, don't worry about that lump under your arm. Or the stories go on and on. The woman must be empowered, and this book will empower women to take charge of their breast health, know more about it than their doctor, and demand optimal care.
I have a very good doctor and had a biopsy when I was 9 months pregnant. So I know it happens.
Yes. And they're so afraid to do that. But you had a great doctor. A doctor that listened to you, did the right thing, proved that it was benign, and here you are today. But
I think that also when you're in that state, your brain isn't working quite as well as it could be. And people tell you, well, yeah, your breast changed when you're pregnant.
Exactly, and there's so much confusion on every aspect of breast care, where it's when to get a mammogram, self-exam, density. All these issues are, if you go to Google, you get Googleitis because you get all this confusing and worrisome information. That's why the book was written, to condense this information from birth to elderly, all aspects of breast care. We go right up to just diagnosed with breast cancer care, and end with the importance of hope, and tell stories of people with metastatic disease who were told to fill out their will and end up there. One of them is a 30-year survivor that's a volunteer at our own center in Orange, Barbara Scott. There's a whole section for Barbara Scott. And then another patient who made the appointment of how important it is to get a second opinion, and another, Carol Fullman, who's a patient at our center, and she demanded a second opinion. It changed her course completely, and then she went back to the pathology department and made them change their whole approach to analyzing breast biopsies. So one woman's story, one woman led the drive to improve the quality of pathology in a major hospital in Orange County, and now for the next 20 years, the hospital's doing a better job. So there's so many lessons, from not just what the woman needs to know to take care of herself, but when to get a second opinion, where to find a place that really can listen to what they do and care for the patient.
How do you know? I mean, obviously, it's in your family. It can be hereditary, but how do you know that you're really high risk?
Well, that's an interesting question, and the easy answer is Angelina Jolie, whose mother died of ovarian cancer when she was young. Multiple family members, they tested her. She was BRCA1 positive. She undergoes prophylactic nipple-sparing mastectomy. Her risk of dying or getting breast cancer go from 80 to 90% down to less than 10%.
Would you have recommended her to do what she did?
Absolutely. If she was my daughter, and that's what I do, I recommend what I would do if they were my daughter. I would absolutely. A nipple-sparing mastectomy. My son wrote 2 articles on reconstruction, Dr. Justin West, and he's done a beautiful job. He was trained in Georgetown. He's a spectacular plastic surgeon, but he's superb at reconstruction. So many of our women who undergo nipple-sparing mastectomies end up looking better than they did, at that time, sometimes as good as they did when they were in their teens or 20s, because we can make a nice, perky breast with the nipple in the right spot. The same thing is true with women with very large breasts that develop a cancer. We now can do a much wider removal of the cancer. We reduce and reshape the breast such that it's a youthful shape, and then match the other breast. These women come into the office and they can't keep their tops on. They want to show everybody. I mean, I haven't looked this good in decades. Take it off. I said, can you wait till we get you in the room, please? This is the waiting room. Everybody's here.
Well, and that's fantastic, because at first, any indication to any woman, anywhere, anytime, that there's any sign of breast cancer, immediately I'm going to have a mastectomy and my life is over.
Okay. Now that's going too far. I understand it with really young women, have children. They're looking at 30, 40, 50 years of survival. They're thinking of that yearly mammogram, going through all this trauma again. We explain to them, you do not have a better chance of surviving by taking both breasts off, but you don't have to go through the trauma of every, maybe getting a call back, or maybe another biopsy, or maybe the worry of something else. But so it has its advantages, but the number one thing I advise is, if you're a candidate for saving your breast and you listen to both sides of the question, that by and large, breast conserving surgery is so easy. It's so effective. The proof of the pudding is my wife was diagnosed with breast cancer.
Oh my God.
She had the 3-dimensional mammogram in February of this year. One view of the multiple views, sort of little bitty change. They biopsied it. It was a lobular cancer. She underwent lumpectomy, sentinel node removal, and radiation. She's on some medicines now, no chemotherapy, but by catching it early, she looks normal. You can't even tell she had a little bit of change from radiation. Other than that, and it was an outpatient surgery, and she's going to do well. So that's what I tell my wife, because that's what my wife did. So the book is intellectually honest, but if I had a daughter, here's how I say it in the book. I have a chapter on why so many mastectomies. I've been through it from radical mastectomy to modified radical to breast conserving surgery. Now we're doing so many more of the bilateral. I say, the patient asked me, Doc, what would you do if I were your wife or daughter? I said, look, imagine I had 2 twin daughters. They're your age. They have exactly the same thing you have. And daughter A comes to me and says, Dad, I've thought about it. I want to have both my breasts off. I want reconstruction. I said, well, I think it's a little aggressive, but this is your thought. I can tell you've done your homework, you've talked, you've really thought about it, you understand the pros and you understand the cons. That's what you want to do, you have my blessing. Daughter 2 comes in and says, Dad, I think I'm going to just do a lumpectomy, some radiation. I think that's all I need, and I'm comfortable with it. I said, you know what? You made the right decision. You see, there's some fork in the roads where the decision is balanced. And sometimes some patients, the younger patients, children, I think the bilateral nipple-sparing mastectomy is the choice. This A-cup patient that gets breast cancer, I convinced nipple-sparing mastectomy because when we remove the lump and then radiate, that A cup goes to an A- cup, and they just don't look very good. Whereas if we do a nipple-sparing mastectomy on both sides, do enhancement, now she's got a C cup or a D cup, whatever she wants. She can wear bathing suits and clothing she couldn't wear before. They're proud of their self-esteem goes up. They think they've had a home run on this thing. They've been cured of cancer and they look like $1 million. That's not a bad return on investment.
So why the book? Where did the idea come from?
Well, it started a lot from just all the confusion. And I think one of the big confusions, one of the chapter is Shame on You, Charles Krauthammer. And I was listening in the background of Fox News was on TV, and I heard Bill O'Reilly say, my next guest is Charles Krauthammer, and he's going to talk about the mammography controversy, a new study from Canada. I said, wonderful. He's a doctor. He's knowledgeable. He'll debunk that study because it's totally flawed. Oh, my God, how wrong I was. His first line is, mammograms cause more harm than good. 22% of breast cancers would disappear without treatment. Doctors are over-treating, and he went on from there. Well, it turned out he, just like so many smart people, was 100% wrong, and at that point said, I got to set the record straight. I got to explain what the benefit of mammography is, how we can make it better, what the patient should know. And then all these critics, like a Charles Krauthammer, who are ill-informed and basing their decisions on flawed data and flawed studies, we have to stand up to people like that. As much as I think he's a great guy and a smart political commentator, he was 100% wrong. And not only was he 100% wrong, but he was giving bad advice on a major network. And a lot of women say, I don't need to have a mammogram. Even more egregious, he made the statement that 22% of all breast cancers will disappear if untreated. In other words, we're treating chemotherapy and whatever for 20. This is utter nonsense. No cancer will disappear, has ever been documented as disappearing. We do know that in elderly women, and where he has some semblance of credibility, if I have an 85-year-old woman and a low-grade cancer, in theory, that she's probably going to outlive that cancer. Usually do a needle biopsy of it to prove the diagnosis, or just follow her clinically. But if you have a woman in her 40s, and even a low-grade small cancer is going to become a killer cancer if you give it 5, 10, 15 years, why would you not treat it then when it's 99% curable rather than wait 15 years where you've proven it's growing? But it's idiotic to say that these cancers, 22% will disappear. It's based on a numbers game. Just if you were doing, for instance, people evaluating global warming, develop models, right? They're statistical models, so they plug in data. Well, if your bias is there's global warming, you plug in data that confirms your bias. So if you don't believe it, you change the data. Well, these people...
And there's a name for that. I can't think of what it is.
It's confirmation bias, I think is what it is. And we all do that. We can't help ourselves. I'm biased towards, the early mammogram. I can give you my, logic behind it. And they present their logic in terms of statistical models. For instance, one that just came out in the LA Times last week suggested that, again, mammograms don't work and that we're overdiagnosing breast cancer. They looked at statistical models from SEER data before mammograms were done and after mammograms were done. And they made some assumptions and said they don't work. But here's the problem with that data they looked at. They didn't know who had a mammogram and who didn't.
Oh, for God's sake.
So it's all modeling. So when we look at populations that are underserved, we see a lot of advanced cancers. Then when we go into those populations and we start screening the patients, we pick up these early cancers and the advanced cancers go away. So when we know who's had the mammograms, we know it works. But when you do a modeling where you don't know had the mammogram, you can come up with answers that are totally illogical. 22% of cancers disappearing. Hello, there's never been a documented case of a single breast cancer disappearing without appropriate treatment. Some of them grow slowly. None of them disappear. all this stuff from Charles Krauthammer and the other commentators and the other ill-informed people is simply dangerous to the women in this world. It needs to be rectified. And that was the driving force to write this book.
Now, you started out as a general practitioner. How did you get here?
Well, that may be a bit of a misstatement. I started out as a general surgeon. I trained in San Francisco in a trauma center, and I came here, and my primary interest was developing a regional system of trauma care in Orange County. And so we had a system there where patients were taken to the closest hospital. If they didn't have insurance, we called it a wallet biopsy, they were sent off to the county hospital. A lot of patients were dying, and so I did a study showing trauma deaths in Orange County versus San Francisco, where they had a trauma center, and it showed that, that in a trauma center they didn't have preventable deaths, but in our system they did. Well, we converted to an entire regional system of trauma care, the first in the nation that was approved by the health care department, and it was held accountable for their results. Independent reviewers would come and look at it. We went from poor quality trauma care to saving thousands of lives. It was highly effective, and it went national. And so that was my big claim to fame, my first decade in practice. And then after about 15 years, I just wore out on trauma care, middle of the night surgeries, phone calls. I said, I got to get into something that I can really believe in and do, and it's not going to be overwhelming. So I said, well, why not apply the trauma model to the breast model? At that time, everything was totally confused. There were imaging centers, and there were general surgeons doing breast work, and there were plastics. None of them were coordinated. So I said, why don't we bring the surgeons and the imagers and the mammographers and the oncologists and the radiation all into a single center where we can give a high level of care, make it efficient, and be accountable for our care. So we applied the trauma model to the breast model. It's been incredibly successful. Now BreastLink is opening multiple offices in Southern California. We have our first office opening in Manhattan in New York.
Oh, wow.
It's a coordinated care where the surgeons, everybody works together as a team in one place, and their service model is unbelievable. If a woman calls with a lump, they'll see them within 24 hours of that call, usually the same day, and get that evaluated, get the imaging. If it's a cyst, they'll aspirate it. If it's a cancer, they'll biopsy it. It's so incredibly, and then everybody talks to everybody. So the surgeons are talking to the imagers, talking to the oncologists, so the patient in 1 or 2 days can get all this taken care of. Where the average in the community is you're bouncing from office to office to office. Nobody's talking to each other. There's no communication. The poor woman's frustrated. We do it all in one day, and we talk to them. I give most of them my cell number or the back office number. Anytime there's a question, we can talk to them. And we have the website, whatever, they can go, but they are informed and they are feeling cared for.
And you also inspired your son, true?
Well, I hope I inspired my son. I know I did because he's talked about it. But he grew up, his first surgery was at age 5. He injected some local in my shoulder and then took a scissors and cut a mole off and then coagulated the base. So he went to do research at UCI, and he was cannulating rabbit hearts at age 14, I think it was, and he was into research, and then he went to one of the top medical schools, Jefferson, and then he went to Georgetown, and then went to Manhattan Eye here for cosmetic training and breast training, and he started in practice with me in 2000. He has one of the busiest practices in Southern California. He's written 2 chapters. He's a super duper guy, and I'm very proud of him.
Dr. John West, breast cancer surgeon. The book is called Prevent, Survive, Thrive, Every Woman's Guide to Optimal Breast Care. Thanks for being with us.